Welcome everyone to our first lecture, Why Study Global Health. Thanks for participating in the Padlet activity on the words, pictures, and comments that you think of in terms of the concept of global health. I will share our final Padlet once everyone has had a chance to participate. Remember to have your template handy on the different health disciplines so you can take notes as we move through this lecture. So we're going to start off with what is global health and where did it come from? And then we'll discuss One Health and Planetary Health, and then why is it important to study global health? So global health emerged as a new concept arising from earlier health disciplines of public health and international health. So let's talk about public health. Public health emerged in the mid-19th century, specifically in developed countries, or at that time they were developing. So England, Europe, USA, and public health developed due to these deplorable living conditions, low socioeconomic status, poverty, high infectious rates, and high mortality rates. And what we found was there was a focus on infectious disease. There was a focus on what was happening in society and could society have an impact on our health status. So the beginning thinking about social determinants of health. And the breakthrough in biological and medical knowledge. And so germ theory came about and the introduction of penicillin. And what we saw is that from the mid-19th century, we saw this slow increase in life expectancy because of public health. And then the environmental theory, which was developed by Florence Nightingale in the second half of the 19th century, focused primarily on the environment and the influences that the environment has on life, and whether or not someone develops an infectious disease, could that be related to the environment? Could the environment suppress it, contribute to the disease or death? And so really thinking about what is the environment, or what part does the environment play in health? And so again, a little bit broader looking at those social determinants of health. And actually Florence was beginning to think about planetary health as well. So really developing that link between environment and disease. And she also started to collect data, so the importance of data collection. And this is all part of public health. So what defines public health? Well, public health is about decision-making that looks at the evidence. So it's very much an evidence-based practice. So it looks at vital statistics, surveillance outbreaks, the link between data and evidence, and you'll see this loud and clear with our COVID pandemic. Public health also is focused on improving human health from a population perspective versus an individual perspective, which is the biomedical model. And so this is one of the key differences between the approach of medicine and the approach of public health. Public health has a real sense of social justice and equity, and it focuses on those poor, those vulnerable, those with inequities. And again, we've seen this loud and clear with COVID, that there's certain groups who had higher rates of COVID than other groups. Public health focuses on not only, it focuses, yes, on curative, but has a lot of focus on prevention and health promotion. And it's multidisciplinary. And public health is also, we think of public health as more of related to one specific domestic country and a real strong community focus. So let's look at international health. What defines international health? Well, for decades, it was a term that was used for health work abroad with a specific geographical focus on those developing countries. There was a real strong focus on infectious diseases, water and sanitation issues, malnutrition, and maternal and child health. And there was a real divide between the us versus them, and that these health issues were happening all over there in a different country, and they weren't happening to us in developed countries. And we also started to develop this white savior complex that the West knew best. And so we were there to help these poor individuals. And we'll talk more about the white savior complex later. So international health stressed more the differences between countries than the commonalities. Global health, though, is more than one nation helping another nation, as with international health. And this really started with the AIDS epidemic in the 1980s, and things really started to change. All of a sudden, there were individuals around the world that were becoming infected with HIV. And it wasn't just happening in our developing countries, in our continent of Africa. It was actually happening in North America. It was happening in Las Vegas. It was happening in San Diego. It was happening in Toronto. It was happening in Vancouver. And all of a sudden, this phenomena of the HIV crisis and the AIDS crisis started to bring people together around the world because everyone was being infected by HIV and eventually AIDS. And so authors would say that AIDS really invented global health. It disrupted the divide between prevention and treatment. And there was a real focus on prevention, so education and condom use. There was new forms of disease advocacy and activism. A lot of new global funding came through. It changed the cost of essential medications, and so that everyone had equal access to the medications, but we're still working on that. It really recognized basic human rights, and it was a major boost for global health research and academic interest. And so global health took a turn, and it went from the us versus them versus us, or us versus them, to this we impact, so that a big part of global health is looking at these issues that are happening to everyone around the world, no matter where you live. And so what makes something global? And I want you to think bigger. So must a health crisis cross international borders to be deemed a global health issue? And so I want you to think bigger in that, think of COVID right now. I want you to think that global health is more than just a pandemic. It's more than just infectious diseases hopping from one country to the next. And so it's a lot more than that. Although COVID is a huge global health issue, but global health is more than just that. And so I want you to think that with global health, there really are no boundary limits, and that we don't restrict our health issues to health issues that literally cross international borders. And it's a lot more than that. And so the global in global health refers to the scope of the problem, not their location. So think about climate change, urbanization, poverty, tobacco control, obesity, injury prevention, mental health, chronic diseases, migrant worker health, gender issues. These are broad global issues. And so global health is not only about health in developing countries or infectious diseases, it's about health-related issues faced by the human population as a whole. So if we were to break down global health, we would say it's very much population focused. It is focused on prevention, but also cure. It looks at the poor, vulnerable, underserviced populations everywhere. It's interdisciplinary. It sees health as a public goal and a human right. And it looks at those health systems and structures and identifies why is it that there's health inequities in certain countries, what's happening within their health system. So why study global health? Well, it embraces health threats that impact all of us globally, and our primary goal is health equity for all. So why study global health? Well, we've made phenomenal progress in the last 50 years to improve human health. Never before have we seen people live longer, so our life expectancy has increased. Our child mortality rates are decreasing. Fewer women are dying in childbirth. We've made great strides on vaccine preventable diseases. We've also decreased tobacco consumption, which is a major risk factor for non-communicable diseases. And so, one reason to study global health is to gain a better understanding of the progress that we've made so far in addressing global health problems and how did we get there, so to learn from them. Another reason to study global health is to recognize that there's many challenges that still remain. And so you'll learn about many of these challenges over the next 12 weeks. And so it's important to understand these global health challenges that remain so that you as nurses can learn how to address them effectively, efficiently, and fairly. We've talked about that diseases are not limited by national boundaries, and as the world becomes more globalized, the health of people everywhere must be a concern to all of us. There are disparities among groups. There's disparities within countries, from country to country. We see that within Canada. We see it with our Indigenous population versus the general population. They have much higher rates of teen suicide, diabetes, heart disease. We see it if we compare Canada to Sierra Leone. If we look at the life expectancy in Canada is over 80, in Sierra Leone, it's only 52. We'll discuss the health development link and the importance that if people have good health, they can develop economically, their country can develop economically. You'll learn about the ratio or the connection between health of mothers and health of their babies. That if a mother is healthy, her children will be healthy. And then the need for different actors to work together, the importance of bringing this intercollaborative, interdisciplinary work together, and that it's not just people working in public health, it's engineers looking at water and sanitation, it's nurses looking at the health of all communities, it's physicians, it's the economy, it's politics. You'll understand that you'll look at the health in all policy, that health is not just in the health sector, it's in the education sector, it's in the social services sector. And so it's really important to understand that we all need to work together to ensure we have good health. Let's finish off by discussing the differences between One Health and animal health. So One Health is an approach that recognizes that the health of people is closely connected to the health of animals and our shared environment. One Health really isn't a new concept, but it's become more important in recent years. And this is because many factors have changed the interactions between people, animals, plants, and our environment. One thing would be our growing human population and that population expanding into new geographic areas. Just think of urbanization. So as a result, more people are moving in closer contact with wild and domestic animals. The earth is experiencing changes in climate and land use, such as deforestation and intensive farming practices. And these disruptions in environmental conditions and habitats can provide new opportunities for diseases to pass to animals. And another example would be the movement of people, animals, and animal products, which is increased because of the accessibility of international travel and trade. And as a result, diseases can spread quickly across borders and around the globe. So hello, COVID-19. Lastly, I want to talk about planetary health. And so this is a field focused on looking at the human health impacts of the human-caused disruptions of the Earth's natural systems. So it's looking at the impact that we as humans have caused on the environment. So there's no doubt that our global environment is changing. We've gone from the hottest years on record. We've seen some disappearance of pollinators such as bees. There's been a global collapse of fisheries. Um, we're seeing natural disasters like nothing before, hurricanes, tsunamis. We're seeing declining biodiversity, shortages of arable land and fresh water, pollution, and it goes on and on and on. And these are dramatically affecting our global food production supply, the quality of air we breathe and the water we drink, our exposure to infectious diseases, and really just the habitat in which we live in. And so it's so important that nurses become involved thinking about and advocating for planetary health and explaining to our clients of the clinical significance of the impact that we have had on our ecosystem, but also to deal with the planetary health effects of climate change, how to slow down climate change, and to think about the effect that we're having on the planet. So we will discuss in detail planetary health in one of our weeks.